Welcome to Break Everything. Your host, Lisa L. Levy, will guide you through critical thought conversations and a journey of directed disruption that makes a difference. Experience bold conversations with industry leaders who are willing to challenge the status quo.
Hello and welcome to another episode. Today, I am very excited and grateful to have our guest with us today, Dr. Buffy Lloyd-Krejci. She is a foremost authority on infection prevention and control in nursing homes and long-term care facilities. She has more than 20 years of expertise working in healthcare and public health, and her approach is highly collaborative, data-driven, and hands-on. She uses her experience with more than 700 healthcare facilities across the United States to combat the estimated 1 to 3 million infections, leading to more than 380,000 deaths every year in the nursing home industry. For those of you who have been on this journey with me for a while, you know that the elder population is important to me, and the experiences I've had in the last couple of years with my granny drove us to create this podcast. So it is with great excitement that I invite Buffy to our conversation today.
Thanks, Lisa. Glad to be here.
Glad to have you here. It is so awesome to have this conversation. In the United States today, our population is aging, and we're going to get into all of that. But right now, I want to learn a little bit more, and I want you to share your journey with us and how you found your way into healthcare in the very beginning.
So, basically, I've always had a passion of helping people. And my background is, in high school, I loved mathematics and I loved medicine. And I didn't really know what path to go. And, really at 17 years old, I got a specialization to work in hospitals as a hospital unit coordinator. And that really started my journey. From there, I got, degrees in epidemiology and public health. And so I've really been able to utilize that passion of mathematics and statistics with healthcare, with medicine, which has ultimately led me into long-term care, which is truly my passion within this healthcare setting.
That's absolutely awesome. Thank you for the background. What's really the best part for you? What gives you your energy in what you do day in and day out?
Well, I am not one that likes to be bored, so I need things to be changed up. And, I didn't really choose or understand that the path was going to take me the way that it did. I think many people can identify with that in their lives. But for me, I really am passionate about helping kind of the underdog, people that are vulnerable or may not have a voice. And so that is what I really strive for in long-term care. This population is one of the most vulnerable populations that we have. And I love to be able to make a difference, and just seeing the work that I do and my team does and the difference that we can make is what motivates me every single day.
That's absolutely fantastic. Infection control is a highly specialized, and I guess I would call it even a niche within healthcare. And it's probably not the sexiest element of working in the healthcare space, but the statistics in your bio, 3 to 4 million infections resulting in nearly 380,000 potential deaths. It's an impactful place to play, and a place where a positive impact will be felt readily. What took you into that space?
Yeah, it was in 2015. I was working with the CDC and CMS, the Centers for Medicare and Medicaid. We were working on a national pilot study to support nursing homes report an infectious disease, C. difficile, which causes massive diarrhea. It really can affect the elderly in the communal environments. And I was working on this national pilot study. And that's really where I learned of these statistics, of these just exorbitant number of infections, when we really, it's hard to understand 1 to 3 million. It's hard to even kind of wrap our brains around 380,000. Like sometimes those numbers are just thrown out there. But if we drill it down a little bit more, that's over 1,000. It's 1,041 people dying every single day. Like that to me, and this, I always say this was before the pandemic. This was before COVID came into our world. And so when I was really captivated when I learned of that, as well as when I looked around the landscape of the healthcare industry and saw there wasn't a lot being done. This healthcare industry was not prioritized, and we weren't really taking action. It was just this big number and then kind of forgotten about. And so that motivated me to step in and do something about it.
And it probably almost felt like it was just expected at that point, right? The numbers were known, they weren't a secret, but nobody was motivated to do anything about it because that's just sometimes these things happen.
I don't know. Yeah, I don't know if that numbers were actually known. Okay. I think from a public health perspective, there was, if you were diving deeper into that area, you might come across it, but it wasn't like this was highly publicized or really worked on, even in public health. And, it wasn't like, oh, this is just kind of the status quo. I just don't think people were really aware of it, even within public health. There was other priorities. On the 2013 National Action Plan to reduce healthcare associated infections, there was like acute care hospitals, outpatient dialysis, outpatient, ambulatory surgical centers. Long-term care was last on that list. So
it really just wasn't a priority.
Just wasn't a priority. Yeah.
That's unfortunate, especially as we consider where we're at generationally and the baby boomer generation aging and at mass. Yes. Right. That is a large population that is, well, finally now it is actually now a diminishing population as we're starting to lose the older members of our baby boomers. So the need for improvement here hasn't probably peaked yet, but we're getting close.
We are. And really around 2050 is when we're going to really peak, and we're going to need senior care services better than ever and more than ever. And we need to improve senior care services. We need to improve these healthcare services. And that's definitely what I'm all about and advocating for.
And while 2050 still feels like it's far off in the future, to make systemic changes in healthcare, we're probably behind the curve to make the kind of changes to have the impact that we really need to have. With that, and I think that I may be able to make a connection into this, I know that you've recently written Broken and published your book. What was the spark behind that, and where did that book come from?
I started my company in 2017. Like I said, I was just motivated to do more than what was really I was being allowed to, even in the public health sector that I was working in. And then, of course, the pandemic hit, and I was thrown into the middle of the pandemic response, helping nursing homes. Many people are aware that, there were disproportionate deaths and infections within nursing homes. At one point in the pandemic early on, 50% of all deaths were coming from nursing homes. So it was, just a massive challenge. Our nursing home industry, our whole healthcare industry, our whole world wasn't prepared for a global pandemic. And then, we talk about not being prepared, not being prioritized. So of course, our nursing homes weren't prepared as well for this catastrophic event. And so I really was thrown into the middle of it. I was going across the country supporting long-term care facilities. And what motivated me to write the book was that I was hearing the same story every single place I went, whether it was Texas or Arizona or Michigan or Minnesota, Idaho. The story was the same. And I really felt like the nursing homes needed a voice, because the industry can be so punitive that people weren't really standing up and saying this is a problem as far as what they were seeing behind the doors. And So I set out to tell the story of what the nursing homes were going through and their challenges, because typically what we see on the evening news are the horrible events that, you see these horrible situations coming out of nursing homes, and nobody wants to go into a nursing home and the reputation is terrible. So I really wanted to tell a different story than what the public sees, and also to honor those amazing healthcare workers and the staff that show up every single day. They weren't home binging on Netflix. They were showing up to care for the population, and they didn't have the PPE they needed. They didn't have the support they needed. They had the regulatory agency was on top of them, pouncing, criticizing, citing them. It was a very, just a situation that I really felt the public needed to understand. And so it really is a book composed of interviews as well, of people, and even like how we got there, kind of tells the beginning of what we just talked about, the challenges, and then really where we can go in the future. So like, what are some future solutions to change this, to make it not to fix this broken system?
Absolutely. So share with us a little bit about what some of those solutions might look like.
So I talk about, first of all, every long-term care or skilled nursing facility is now required to have a part-time infection preventionist on site within their facility. So if we don't have actually somebody dedicated to working on preventing infections, then it is just about control. So I like to shift the, not just infection control, it's infection prevention. Up to 70% of all infections within healthcare are estimated to be preventable. So I'm like, let's do that. And so having a dedicated, trained infection preventionist on site to really do this work is absolutely essential in being able to reduce the risk of harms and deaths due to infections. That's one of the solutions, is just having that healthcare worker to be able to do that work.
And what are some of the key pieces, high level, in the prevention steps that I understand, right? Controlling after something happened, right? Reactive. We want to be in that proactive state. But, for people who aren't familiar, what are some of those prevention steps?
Sometimes I think that we get a little complicated with our practices. And, one of the things I learned really early on when I started my own company was I had originally stepped out and I'm like, I want all nursing homes to report their infectious disease data into CDC. We're going to understand the burden, and then we can fix this. And I'd come into the buildings and I'd see that they didn't even have hand sanitizer dispensers. They weren't even washing their hands. So how can I expect a nursing home to conduct infection surveillance if I can't even get them to wash their hands, which is the most basic infection prevention practice? We keep the data of all the site visits. We still go into hundreds of nursing homes every year. And I was just looking at the data for 2022, and still about 50% of the nursing homes we saw, a little over 50%, still do not have adequate access to hand sanitizing dispensers to wash their hands. Like, that's frustrating to me, because that has to be number one. And we need them for the visitors. We need them for, the staff. We need them for the housekeepers. So we have to start with the basics. We have to make sure the environment of care is being properly cleaned and disinfected. Lisa, I can't tell you how many times I talk to a housekeeper and they're like, I clean the bathroom first, and then I go in and clean the room, and without changing gloves. And I'm like, well, why do you do that? Well, that's because that's how my mom had taught me to do it. And I'm like, okay, well, we can change that. So we have to start at the basics and get really, really good at the basics, and then start building the program from there.
As you were talking through that and timing, right? We as a society have been more focused on hand washing because of the pandemic than since kindergarten, probably. Right. But as you're rolling back dates, I'm thinking back to working in a hospital system in 2016, 2017, and the hand washing campaigns to mitigate C. diff, right? None of this is new information, actually, right? We
Correct.
all know that being clean is a really good prevention step, and yet it is so difficult to have access to the basic things that we need. I love always starting at the beginning with the fundamentals, and solutions are actually probably more simple than we like to make them. With the book, with Broken, who is it directed towards? Who should be reading this and learning from your experiences?
Well, good question. I wrote the book really because I wanted the public, anybody that needs this type of care, to read this book, to understand what the challenges are, and then to jump into action and to advocate for their loved one, whether they're in a nursing home now or may need it. It has also really touched, kind of surprisingly, or maybe not, but it's really touched the actual long-term care workforce. And I'm always a little cautionary, like, because it can be very trauma inducing. This is what they went through. But I can't tell you how many people have written to me or talked to me and said, thank you for telling our story. Thank you for being our voice. And so, I appreciate that so much. And truly, finally, I want decision makers, those that are writing policies, that are putting legislation through, to read what the challenges are, because traditionally, we've kind of swung like to this far extreme within long-term care. It's like, we're going to cite them, we're going to find them, we're going to punish them for everything. And we've gotten away from this collaborative, supportive, helpful work. And so I really want those policymakers to read this book and truly understand what's going on behind the scenes, so that the right type of action can be implemented to fix it. So I'll just say one thing. So it starts from, I like to say, there's a bottom up approach to fixing it with the families. And my last chapter is directed towards the families, getting involved in the patient family council with your long-term care facility. But it also is that top down. So we need both. We need the government top down, because it's all funded pretty much through the government. And then we need the bottom up. We need families and to speak up as well.
And I think that's a really important point, right? Because systems are impacted in both directions.
Absolutely.
Right? What we have from oversight coming down, but we really need the voice and the advocacy from the bottom up so that we can meet and make the difference. Because directives get pushed out and get pushed down, but if you don't have somebody pushing from the bottom saying this is important to us, it's really hard to get the traction to start seeing the results.
Yeah, exactly. I talk about, like I said, my last chapter is talking about Twyla Bridges, who was a woman that I had met in 2018 in a nursing home, and she was advocating. Her son lived in a nursing home for over 20 years of his life. And I tell that story just to bring to the attention of consumers too, that it's not just the elderly in skilled facilities or long-term care facilities. Sometimes it's our children. Sometimes I also write a chapter about a young lady who was 25 that got in a car accident and spent 6 weeks in a skilled nursing facility. And so truly understanding that this healthcare setting, the acuity is higher, the level of care that is provided is much higher than it used to be, but yet our staffing ratios are the same. They really haven't changed. And so, yes, the difference that families can make. I mean, Twyla Bridges took her issue all the way to the state senator in Maryland and had changes made with her senator. And so I tell that story to infuse hope, and that you can make a difference and you can advocate for your loved one. And it does matter. Your voice matters.
With your experience of more than 20 years, and I realize you were 5 years old when you started in this career, you've seen change happen. The pandemic era highlighted a lot of things. The pain points became very real and very public and very visible. But as we've learned about some of those weaknesses over the past couple of years, are you seeing positive change happening?
I think we will always forever now say before the pandemic, after the pandemic.
Mm.
We're still not officially out of the pandemic, but we're not in the crisis of the pandemic is the way I like to portray it, especially in our nursing homes. There is a post-pandemic situation occurring now where our healthcare staff are critically wounded,
Mm-hmm.
and they're leaving the industry in high volumes, or they're so burned out that the passion that they carry to work with them every day is no longer there.
Yeah.
And so my cry really now, I mean, you talk about changes. I mean, that's our immediate situation right now, where the staff just need support and they need that infusion of care.
Mm.
If we're going to really start to recover and heal, it's like the wounded going to war and coming back. Our wounded haven't had a break, right? They're still in the trenches. And so I don't see a change really, as far as the change is almost in the wrong direction because of the wounded, the staff in the industry. But I do see that what the pandemic has done is it has highlighted the critical need for infection prevention practices within this healthcare setting. And it's giving more people, such as myself, I see it all over social media now. I see people raising up their voices. I see articles just continually being written about this, research studies being, produced. So whereas, in 2019, I felt like I was kind of standing on a mountaintop shouting and nobody was listening, like, we have a problem. Whereas now I feel like as a collective, we're really raising our voices and saying this has to change. And so I'm hopeful that the voices that are speaking will start to translate more and more into recovery and repairing the system that was broken, I would say, before COVID. Yeah. So my hope is that it translates into repairing the system that needed fixing long before COVID even hit.
And as we spoke earlier, right, we're ramping up for an increased need in this space of the skilled and nursing facilities and long-term care. Are there things that you can see, right, those simple, obvious things that would help us position to start making that momentum towards being able to serve the aging population as it grows?
Yeah, I think we're in the middle of that right now. I mean, just the fact that it's becoming more and more of a priority and the voices are louder and we're saying this, we can't continue operating the system this way. Now, this is interesting because after I wrote Broken, it was like, and I even had some people, well, what do we do now? Because the solutions seem like they're going to take a really long time, decades maybe. And so that has motivated and shifted me to write the second book, To Broken, that really describes what we can do now, even more as consumers. Because I don't know about you, like my parents are entering into that phase. And so I write a chapter on, the families and how we're in denial and we don't want to look at this and how to put these measures in place before the crisis happens. And what choices do you have? What is assisted living and independent living and skilled? And how do you decide and how do you pay for it? And, so I think as consumers, we need to be educated and understand long before this situation happened, long before your loved one is in the hospital being discharged and you have no idea where they're going. And that's what happens. So what's exciting and a lot of fun for me, it's a heck of a lot more fun than going through the pandemic and having to write about that. but I'm like, I have my investigative hat on and I'm searching for the best solutions. I am interviewing care facilities, different models of care, like the greenhouse model. I'm looking at different ways of delivering quality care to this aging population with the hope of letting those best practices catch on fire and spread. So it's super fun to be able to talk about these like environments of care, these skilled nursing facilities that are different, but that are highly successful. And I think the public needs to, I'm kind of doing all that legwork for them and peeling back all the layers, and hopefully be able to put this out and really help a lot of people.
I am personally very excited to read the next book, because it is true, right? As this break everything journey for me started watching my grandmother go through crises after crisis after crisis prior to the pandemic. And my parents are actually right in that space where we need to have some real conversations about what they want to accomplish and how they want to live sooner rather than later, so it's done before the crisis mode. Buffy, I love where you're going with that, because we don't know what we don't know, and trying to make those decisions in the midst of a family medical crisis sucks. That's my very, very technical definition. It just sucks.
And I've pulled literature. I've been like, I'm like, hey, if there's already a book on this, I don't need to do it. And I've looked, and really books are like 10 years old, or they're very like, they're kind of just specialized in one area. And imagine if you were like, you're taking your loved one to the doctor and they're like, here's a book, here's a guide. And I want to create a workbook with it as well to take notes and write and things, imagine if we were given that tool. It might just help a little bit. I'm not saying it's going to solve all the problems, but maybe just help us. Like, I feel like I just want to be a coach and coach you on that journey, so you don't feel totally isolated or blindsided or like, oh my gosh, what do I do? So that I'm in the middle of that right now. I've been interviewing just like crazy different people and what people are doing. And like I said, it's a lot more fun than writing about the broken system, because it's all about solutions, right? So that's really
absolutely
fun. Yeah.
Right. And it's an empowerment tool for everybody.
Yeah.
So I have one last question, Buffy. If I gave you a magic wand and it removed all constraints, what's the one thing you would change for healthcare?
Well, for me, what I would change is that people would have access to high quality, safe, effective care that, not just long-term care, but all of us, I could argue that our whole healthcare system is broken, and for the staff to get that love and passion of providing care again, to empower our workforce. I say if we can have a healthy, happy, whole workforce, that is only going to translate to high quality deliverance of care to all of us. And so that's my true desire. And Lisa, do you have that magic wand for me?
I do not have that magic wand for you, but I will share with you that, like many other guests on here, right, that your vision of the future is a more healthy, supportive, holistic, right, continuum of care that includes the healthcare providers. One gentleman I spoke with early on said, I don't work in healthcare. I work in healthcaring. Mm-hmm. And we need to care for ourselves, the providers, at every step of the way, including housekeeping and people who are cooking and providing the food and the meals, right? There's a large number of people above and beyond the patients and the providers. I have so enjoyed our conversation today, Buffy. I am so happy. Thank you for sharing where you're going with the second book, so that we have something to look forward to, because I do believe that we need that tool set to help us plan for the future and prepare for aging generations, and obviously those times when skilled care is needed that may not be for aging, but for recovery from something catastrophic. This has been a wonderful conversation, and you are definitely directing disruption to make a positive impact. Thanks for joining me today.
You have just experienced Break Everything with Lisa L. Levy. Critical conversations on directed disruption that makes a difference.